crisis returning a patient like Sue?
Emergency rooms are the front lines in a fight over prescription drugs. It's where addicts like James Morin would go to try and get a fix.
And I broke down crying in the emergency room, saying that I needed help.
As ER doctors like William Hurley try to figure out who really needs the meds.
They're tired of telling people, no, you can't have any more pain medication.
Hurley, who is also medical director of the Washington Poison Center, thinks he knows why prescription drug abuse has soared in the past decade.
In medicine, about 10 years ago, we saw a big swing in philosophy toward trying to control people's pain much better than we had before. And I think what happened is we went a little too far, and we're providing far too much in the way of pain control drugs.
The more drugs prescribed and simply out there, the more potential for abuse. Dr. Jennifer Sable says her research at the State Health Department backs that up. And there's another factor.
Yeah, there's a lot of misinformation. They think because it's a prescription drug, then it's safer.
They misuse their own prescriptions or take drugs prescribed for friends and family. And once you're hooked, 17-year-old addict Alex warns.
And I would have to have it day to day. I mean, it would suck because you wouldn't get as high. It would just do it because you needed it to sleep or to function.
King County Medical Examiner Richard Harris.
As we take more and more of the drug, it becomes less and less effective. We combine it with alcohol and with other drugs.
And they end up in his morgue. So our investigation found the wide availability of prescription pain pills, the belief that they're always safe, their addictive nature, and the tendency for people to mix them with other drugs and alcohol has all led to a big increase in prescription drug deaths. Now, what do we do about it? Well, it turns out
many of these people who die, they're not trying to get high.
Hurley says research shows people addicted to Vicodin, methadone, OxyContin, and the like often have underlying psychiatric or untreated health problems. When patients like that are given consistent care with a primary doctor,
we see, number one, a significant drop in the amount of pain medications that they require. And we see a significant drop in the frequency of visits to the emergency department.
Some hospitals and pharmacies have begun to share information about patients so they can identify and help addicts. What if you need to keep prescription drugs here in your own medicine cabinet? Gina Grapponi with the Addiction Help Group SAMA says make a habit of
checking what you've got in your medicine cabinet or in your home and locking it if you need it and disposing of it properly when you don't need it anymore.
Disposing is a challenge. Flushing the drugs, even throwing them in the trash here, could harm the environment. There is legislation, though, at the state and national level to legally allow pharmacies to take them back. Drugs czar Gail Kurlikowski.
We're confident that Congress will pass a law that helps clean out these medicine cabinets so that these dangerous drugs will be disposed of in a safe manner.
In the meantime, some police stations will take the unused meds. Contact your local department. Finally, addicts and those who love them want you to know this.
Recognize it is a disease, and we need to eliminate the stigma.
You gotta look at people and say, what's wrong? How can I help you? Here's a rehab facility. This is medical treatment. You need to go get medical treatment. You need to get help.
There's so many people out there who struggle with this, and so it's okay to ask for help.
Our investigation shows prescription drug abuse can be deterred, but patients need comprehensive health care and understand the potential danger of prescription drugs. Government regulators must provide better options for disposing of drugs. Hospitals and pharmacies should share information about patients who request a lot of pain meds and provide help to those who are addicted. Heather Bosch, News Talk 97.3 Cairo FM.